Hi, everyone. It's Stephanie with The Patient's Story, and I'm so excited to introduce you to our guest today, Dave, who started a podcast just a couple months ago, and we'll talk about that later too, the research evangelist. Welcome, Dave.
Thanks, Stephanie. Appreciate you having me on your show. It's great to be here.
Yeah, we were just talking a little bit, and Dave and I feel we are very aligned, I think, in our mission to help patients, caregivers out there. And I'm so excited because, Dave, you'll be talking about your own lung cancer experience, the diagnosis, the treatment. And then, of course, a lot of what we'll talk about is the advocacy work that you do because, in the work that you've done, I believe you've spoken with many people and you've gotten these perspectives from other patients and caregivers. So it'll be wonderful to learn from you. So before we begin, I like to start off with, what are some other things about Dave outside of, say, lung cancer and advocacy work that speak to who you are?
Oh boy. Well, a lot of what I would say defines me, is from my cancer experience, but it more just amplified my background. I'm a Minnesota guy, but I've been living in Boston for a long time, and been married for 30 years, and so I'm just really grateful, for the wonderful life that I have, and basically, the experience of surviving a cancer scare. It changes you, as people know. It's just changes everything about how you look at life. But I live a life of gratitude, and I try to be focused on that when I bring positive vibes to everybody that I encounter.
Absolutely. We could all use more positive vibes. So I'm here for it. Dave, thanks for sharing that about you. Would love to maybe just jump right in then, if you're ready. If you could talk about just what were the first symptoms or feelings that made you realize, hey, something's not right here.
Uh, uh, it really started. I was a young guy. I was a non-smoker, and I was up in Maine with a friend of mine fishing in May. It was freezing cold. I remember this, but I got super sick while I was up there. I was the chills, and I came back, and it turns out that I had pneumonia. I went in and saw my doctor, and got the chest X-ray. I got the antibiotics, and was pretty much just told to be on my way, right, and just to take care of myself. But I remember thinking at the time, and my wife thinking at the time, because she's a nurse, is that seems really weird that I would be getting pneumonia, because I was playing basketball every day at the YMCA down the street. And so I was a really healthy, didn't smoke. You don't even think about it. And a lot of us that get lung cancer, we don't think about it. So time went past. About 6 months later, I got sick again, and I got pneumonia again. And so now you're like, okay, I'm 34 years old. I'm healthy. And why did I get into lung cancer again? And now I was getting like worried about it. So I went in and talked to my doctor in the same process. Well, radiologist, actually, I was fortunate. Radiologists noticed that the infection in my lung was in the same spot as it was the first time. Because again, I think a lot of primary care docs don't really think about screening. You don't screen for lung cancer, right? You just so, and that's when I got the call. I remember the call that I got from my doctor um, after that, telling me that I should go get a CAT scan. So then I went and got the CAT scan, because he said, we just want to check and see why is it in the same spot? There might be a blockage, there might be whatever. Well, it turns out, of course, that there was a tumor. And that's when I remember the day that my doctor called me and said, Dave, it's Lee. You need to come see me. We found a tumor in your lung. You have lung cancer. And that's when my life just flipped upside down, because I couldn't have even imagined that would be what I would hear from him. Because it just I'm just now just thinking about it, I get emotional about it, because it was just so profound. So
Right.
I think those were, my initial feelings about it, was utter shock about it. But then thinking, I was, hanging up the phone, and just everything was just speeding up, and it's like, oh my gosh, my boys, I have 5-year-old, a 3-year-old, and a 1-year-old. I've got, oh my gosh, what do I, so I think those are probably common, and you probably have similar
Right.
experience, Stephanie, to those emotions.
Absolutely. And yeah, it doesn't matter how much time has passed. It's such a vivid sort of memory, isn't it? And it's visceral, the feeling. And so, Dave, at that point, the word cancer technically hadn't popped up, right? It was tumor. I
No,
mean, it was probably
with the CAT
pretty,
scan, it did, yeah,
it did.
because they
Okay.
could identify it was a neuroendocrine tumor, so they could identify it. They couldn't tell the stage or just
Oh,
by the size they could tell the stage, but they couldn't tell, how aggressive it was. So, and the only
right.
treatment for that type of tumor in that location was lobectomy, which is surgery.
Right, right. Okay. So by that time, even that first preliminary call, he'd already said neuroendocrine tumor. You pretty much got the message that that cancer is what you were
Yeah.
dealing with then. So at that moment, I guess the question is one, how did you process? How did you process it? And then two, did you think, how am I going to break the news?
Well,
You know.
I can share something that's probably really useful for people, for patients, whether it's a neuroendocrine tumor or some other form of it. Is I I reacted by deciding I'm going to go find out everything there is to know about this particular type of tumor, and that was in some ways not the right thing to do because all I did was stress myself out because all I was doing was reading the worst possible outcomes. I was catastrophized myself. So um, I, I process this by saying I'm just going to go and I'm just going to find as much information as possible. But again, it was journals of thoracic surgery and very complex. It wasn't really user friendly. But again, this was a long time ago. So um, but then, of course, breaking the news. How do I talk to people about it? Who do I? Obviously, my wife knew, but like, how would I share it with my friends? How would it impact my work? But really, all just sort of lining up emotionally of all the things that I needed to do um, between going and seeing the respiratory therapist and meeting with potential surgeons that I would have to be um, uh, working with. But it also mostly was that it's in me and I need it out now. But it wasn't all hands on deck kind of thing because it was I didn't have to go immediately into chemotherapy or something. So I think that's the process, that emotional part of it. So you don't scare yourself, but you have to start finding support for what you're going through.
Absolutely. And nowadays, at least, we have more access to finding that support because the internet and social media and all the resources. And so, what were the next steps after that? So, you hear this on the phone, which, by the way, I did too. It was over the phone. And yeah, what were the next steps? And then, if you did go through, I know you that CT scan. Is there anything you'd like to add for people who've never undergone one, just in terms of what to expect and
Well, I think that, I mean, the way I understood at the time, that the chest X-ray couldn't define what was wrong. So the CT scan was the logical step, and I don't think that I'd ever had one before that. So I asked I had a meeting with my doctor to talk about the steps. So he was kind of like my quarterback, which I think is also when people are diagnosed, it's like trying to find that that thinking about your care team, right? It's like for me, it was going to be at Mass General Hospital because that's where my primary care was. But when my mother had an experience and she was in a community setting, she had to decide whether she wanted to stick, with her local community hospital or whether she was going to travel to. She lived in Palm Springs actually, so she would travel to Los Angeles to get her care. So um, I had a pretty good understanding of what the CT scan was all about, based on talking to my doctor. And again, my wife is a nurse, so I was I was lucky about that.
you brought up a really great point, which is this difference between, say, like a research academic center and then like the community hospitals, which most Americans, they go to the community hospitals. Um, we can talk about that a little bit later. I do want to ask one point about second opinions. Had it ever crossed your mind? Did you get one? If you did or didn't, why or why not?
I didn't, um, and I think it's because I'm I again I feel like I was emotionally I felt like I was in the best place possible, and I didn't feel like my in my particular situation it was a very complex issue and the type of tumors that I had was something that Mass General had a lot of experience in. And so, but I'll tell you an interesting story because you're in San Francisco. I had someone contact me last year, 2 years ago, and said, Dave, I want to introduce to a friend of mine who has lung cancer, and he went to UCF to get, he got an opinion, but he wants to know if she could get a second opinion. So I said, I'm happy to connect. So person calls me, and without knowing about his stuff, I said, absolutely. If you want the comfort of having a second opinion, absolutely you should have a second opinion. And if your doctor thinks that you're crazy to do that, then that's on him or her, because you deserve it. If you want it as a patient, you have to be your own patient advocate. You have to be your own in charge of your own care. And so, and interestingly, it turned out, I looked up the name of the doctor that he was seeing, the oncologist at UCSF. It was one of the top guys in the world. So I'm like, and it turned out he had the same type of cancer that I had. How serendipitous was that? So I would absolutely, it's each individual person is different, and I think if you do feel the need, or if you feel that you're not comfortable with what you've been told, then you should absolutely, seek out a second opinion.
Right. And you brought up a point too, which I've heard before. And I think it is really important for patients and caregivers to hear, which is if you have a doctor and they're not comfortable with you getting a second opinion, outside of maybe it being a time health issue, like we don't have a lot of time to work with, it's typically not a great sign, right? It's like if a doctor is going to prevent you from taking a step like that. Even oncologists I've spoken with say, yes, by all means, I encourage patients to get a second opinion if they want one.
Right.
And some are adamant that you get one anyway, just because more minds. So
Well,
thanks for sharing that.
and not to mention the fact that um, a lot of it, sometimes it's a generational thing, like with my mother.
Right.
She wouldn't seek out because she just trusts her doctor, right? She's like, well, no. And so I think it's important for someone who, if you have a parent and you're a caregiver, or part of your caregiver, the team of caregivers, then that person, like my mother, may not think to even ask to get a second opinion.
That's a really good point. Yes, generational, different times, sort of different attitudes, and things are shifting constantly. Okay, so great. So you talked about your type being more complicated. Can you tell us again what that specific type was? And then you did find out the staging. Was that after the surgery was done, or?
Um, the staging was based on the size. So it was stage 1B. So it was like a 3 centimeter tumor
um,
in my lower left lobe. And from the CAT scan, they could tell from the shape of it, and it was localized, that it was a neuroendocrine cancer. Um, and then during my surgery, they did check the lymph nodes.
mhm,
And so after the surgery, I did find out that there was no spread
good.
of the disease. And so that's when you kind of get the final classification of the um, of the staging, I should
Right.
say.
Okay.
And so because it hadn't metastasized, then there was no other immediate attention that needed to be done other than the recovery from the surgery at that point.
Great, and we'll definitely talk about that in the next clip here. As we wrap this up, I would love to understand. At the time, was there any talk of uh, mutations or genetic testing or anything like that, or that just never came up?
It really never came up, and like I said, it was a long time. It was like 1998, so it was a long time ago. And there's so much more knowledge, as we'll probably talk about targeted treatments and stuff now. But for me, it was really, for me, I can speak to the people who have had lobectomies or are anticipating having a lobectomy. It's a very tough, invasive surgery. I was in the hospital for a week on um, heavy doses of medicine, so it's on morphine, at a morphine drip, but it didn't even help because it was so painful that even with a morphine drip, I was still in pain.
Oh
So
man. Okay,
yeah.
we'll dive into that then next. Is there anything else, Dave, about this sort of first part of getting diagnosed that you think you might have some guidance on for patients and caregivers? Any last thing you want to say about this part of your journey?
Well, what I would say, and we'll probably talk about this, but there are ways to connect with other patients now, I think, and that's what I would encourage people to do. If you get that initial, I've been diagnosed, oh my gosh, what do I do? And that whole process of setting up a care team and making those decisions. Is it community setting? Is it academic setting? And who's been through the same thing that I'm anticipating, and who can help me.
Perfect. Okay, great. So with that said, we're going to shift over to the next section, the next video, where Dave will talk about his surgery and the recovery. So hang tight, Dave.